Hello, my name is Lorna Dysart and I'm one of the Clinical Teaching Fellows at the School of Dentistry here at Queen's University. So my job is to teach dental students from first year all the way through to final year. And I'm going to talk to you about dentistry at Queen's. So one of the first questions you might have at the moment is why dentistry? And in particular, why dentistry at Queen's? So if you're trying to decide as to what you're going to study and you think you're interested in dentistry, we're just going to talk through why you may want to become a dentist and what it involves. So the first thing we'll talk about are the different roles within the title of dentistry. So the first one would be high street practice or normal family practice. And that's probably what you think of when you think of a dentist. So the dentist that you attend for your normal checkups and any treatment that you require. It would also include orthodontic practices and specialist oral surgery practices, which you may also have attended. The next group would be hospital dentistry, and that's a highly specialised service. They offer advice and treatment to patients, usually on a referral basis from practice. And the treatment is usually out with the scope of practice. The salaried dental service, also known as the community dental service, provides dental care for patients with special care needs. They would provide care to long-term residential patients in homes, and any sort of residential setting where they need to access care. They'll provide treatment to homeless people and patients with special needs that can't access their normal practice. Then we have university and research. So university would be a job similar to mine where we teach dental students, and also there's some research carried out within dentistry. So some things to consider before becoming a dentist. So I've listed some advantages and disadvantages. So advantages, first of all, you will be a registered professional. So you'll be registered with our governing body, the General Dental Council. And with that comes a list of rules and regulations which you will be expected to adhere to. You will have a good level of income right from your point of graduation when you commence foundation training and all the way through. It is a job where you have the ability to help people, to improve their oral health, to improve their smile. So you need to want to work with people. The job allows for certain lifestyle choices. So that may be working part-time as your job permits you to. There will be an element of job stability as a dentist, and you will also be self-employed. With that comes some disadvantages. So it's certainly competitive for places to find a place to study dentistry. It's a 5-year course, followed by 1 year in foundation training. And at that point, then you can practice independently. There's a certain element of stress involved in the job, both because of the job itself, but also because you will be dealing with patients who have certain levels of anxiety, and you'll be trying to calm them as well as look after a dental team and all the issues and the stresses that are involved with that. It is a physically demanding job. You'll be expected to sit in certain positions to be able to treat patients, so it can be physically demanding. You will be able to manage a business as well as having to manage your own self and your own development. I've also put self-employed under disadvantages because there are disadvantages to self-employment as well, including no paid holidays. So over the next couple of slides, I've listed the advantages again, and just what I talked about each of those, as well as the disadvantages of being a dentist. So why Queen's? So first of all, some information on Queen's. We have 100% employability on graduation. We've been ranked first in the UK for dentistry in The Guardian 2017, and second in the UK for dentistry in The Times and the Sunday Times Good University Guide in 2019. We are fully accredited by our governing body, the General Dental Council. We've had investment across the building, and the picture shows some of our new clinics that you will get to work in. There is a dental foundation training scheme in which our students perform particularly well, and this allows you to work anywhere in England, Wales and Northern Ireland, as well as a separate system which allows access to jobs in Scotland. There's also an option for an intercalated degree throughout your undergraduate career. So this is one of the university league tables, and you can find these online. Your careers teacher should be able to help you with these as well. And it will give you information on each university and each course at each university. So you can have a look at dentistry across every university at which you can apply, and how we rank across the board in Queen's compared to other universities that offer dentistry. The National Student Survey is a satisfaction survey of how our students feel we have performed. And as you can see, we rank particularly highly amongst the UK dental schools with good overall satisfaction scores. So how many places are there? We have an intake of 60 students per year, 45 of these being UK and EU students, and 15 places for international students. Entry requirements at A-level are 3 A's for those with A-level chemistry and biology, and 3 A's for those who have taken chemistry to A-level, as well as 1 for maths and physics, and a B in AS level biology. Maths at GCSE level is required at grade C if not offered at AS or A-level. So how do we select our students? It's really a 2-stage process. We've got your personal statement, the academic criteria, and UCAT. And this all leads you in to the interview stage, where our applicants are interviewed, and then that final decision about whether or not to make a conditional offer will be based solely on your performance at the interview. So GCSE. Points are awarded for your 9 best subjects, with 4 points awarded for an A star, which is grade 9 in the new grading system, 3 points for an A grade, which is grade 8 or 7 in the new grading system. Points are not awarded for B and C grades, grades 6, 5 and 4 in the new grading system. UCAT score is then added to your GCSE total. And more information on UCAT can be found at this website. It can offer up to 6 additional points. And this slide shows the banding of UCAT scores and the number of points awarded. So these points are added to your GCSE score points, and that determines your entry point for interview. Now, just a word, just a note to say that your application for 2021 for this year is 15th of October. So you will have to ensure that you have sat your UCAT prior to this date. So the points awarded for GCSE and UCAT are total together, and that will give you a threshold score where we then interview our students. So it tends to bounce about a bit year on year, but it's in and around 28 to 32 points. Things to include in your personal statement would include work experience, but also from your own point of view, it's really useful to have some insight into the role of a dentist. So ask your own dentist about some work experience, and whenever you go along, consider the positive and negatives of the job. Look at how they deal with patients. Look at the roles of the different team members within the dental practice and what each of those team members do. Ask about the demands of the job, not just the positive parts, but also the negative parts. Have a look at any current issues in dentistry. Look at the different treatment options that are available within your high street practice and how options vary from patient to patient. Consider the cost of dentistry. Consider the cost to the patient. Consider the cost of running a practice. We would like to see an ongoing commitment to dentistry. So don't be afraid to visit different types of practices and even any sort of care-based environment. So that may include a children's hospital or a nursing home. All of these are useful experiences. Your personal statement. So we've covered a little bit of this already within the work experience. So ensure that you tell us about your work experience, include that in your personal statement, and why you feel dentistry is right for you. Include in that any career aspirations you can think of, any relevant interests or hobbies, or any sort of relevant experience, including part-time jobs that you've had that show us that you have leadership skills and teamwork skills, along with communication skills. Would like to see that dentistry is your career choice and that you're not jumping around between different career choices. Tell us what you've done to find out about dentistry, and that will include your work experience and maybe any other further reading or talking to current students that has led you to this decision. So all of these elements will get you over stage 1 and into stage 2, which is the structured interview process. When you come along for your interview at the School of Dentistry, you'll be giving a prep talk first of all, so you'll know what's involved. And then we'll take you along to where the interview is held. You'll move between different stations. There's different questions at each station, and usually 2 interviewers per room. And each interviewer will have a different question for you. Please remember that what happens in one room has no effect on what will happen in the next. So if things don't go so well with one question, it has no bearing on how you'll perform in the next room. Each of them are marked individually. So interview tips. Prepare for it as if it were an exam. Have a mock interview at school, with your careers teacher, at home with your parents, or even with yourself looking in a mirror. This may be your first important interview that you've had, so it's really worth preparing for. Consider your body language, the speech you will use, and even how you'll dress and your appearance. We'd like to see a professional appearance. So some of the topics to be covered include maturity and responsibility, questions on your interpersonal and communication skills, and you'll be able to show us your communication skills. We'd like to see elements of confidence and self-awareness, as well as empathy in certain situations. Your ethical and moral values will be tested, as long as your commitment to dentistry and what you know about the job as a dentist. I've included some information where you can, or on different websites where you can get more information. So we've got the Queen's website itself, and have a look at the prospective students on this link. We have got the Times, where we talk about the education guide there and the Guardian education guide, the British Dental Association, the British Dental Health Foundation will give you information on specific treatments that patients can have. Our governing body, the General Dental Council, has information on what they expect of as a dental student. And have a look at the National Student Survey about what students think of our dental course. So we'll move on to the structure of the dentistry course itself. So it's a 5-year course. It runs mainly between the main site at Queen's and the School of Dentistry at the Royal Victoria Hospital site. In years 1 and 2, it's a basic introduction to what will happen in 3rd, 4th and 5th year. So lots of generic dental skills will be taught. You'll have placements within the community dental service and also the dental school. And in year 2, you have a clinical assistantship where you will attend some of the clinics where our 3rd, 4th and 5th year students are, and you'll be able to assist those final year students. You will also be taught some of the clinical skills that are carried out in the more senior years, and we teach that in the clinical techniques lab. And as you can see in this slide, you will work on a phantom head where we use plastic teeth, and you will learn all the procedures that you will carry out over the next few years. The setup is very similar to clinical practice. You have all the hand pieces and the equipment that you would expect to find in practice. We use live camera shots as well as pre-recorded videos to teach you, and every unit has got its own screen where you can see what's happening at the teaching unit, and then would ask you to carry out that work, and you'll be supervised by members of staff. Halfway through 2nd year, you will also have your local anaesthetic course, where you'll be taught about local anaesthetic as well as how to administer it. Once you have passed the competency related to this subject, you'll then be allowed to give local anaesthetic under staff supervision to patients who are then treated by mainly 4th and 5th years at that stage. So you will go along to the clinic. Staff will help you give the local anaesthetic, and then the more senior student carries out the rest of the treatment. So that's from halfway through 2nd year, January, February, March of 2nd year. We'll be expecting you to treat patients. So all the techniques that you learn in Phantom Head and that clinical techniques lab, you will then carry those out on patients. So 3rd year, 4th and 5th year, you will attend a lot more clinical sessions. 3rd year, you have some traditional teaching in the morning in medicine and surgery, microbiology and pharmacology, with afternoons spent in our clinics and our labs. 4th and 5th year, you will attend mainly clinics, morning and afternoon, treating patients. The clinical areas are split into restorative dentistry, orthodontic and paediatric dentistry, surgery and oral medicine. We regularly recruit patients for each of these areas, so we always have a good selection of patients for you to treat. So if we talk about restorative dentistry first of all, so that's restorations, that's some treatments for gums, making dentures, providing crowns and bridges. It includes root treatments, broken teeth, and restoring teeth when this happens to them. Teeth where there's dental caries and you have to remove caries and restore those teeth. And this is where patients had some implants, and we'll be expecting some sort of restoration on those. Here we have a broken tooth and a tooth prepared for a crown. And those are the sorts of cases that we would expect our students to carry out and they are able to carry those out under the supervision of staff. You'll be expected to attend periodontal clinics where we clean some of patients' gums and look after their dental health in that way. Oral surgery and oral medicine involves some of the lesions you'll see in the mouth, and sometimes these are an indicator of other things that are going on in the body. There's also lesions such as ulcers and oral cancer that you will see in oral medicine. And you'll be expected to extract some teeth in oral surgery as well, under the supervision of staff. For orthodontics and pediatric dentistry, many of you may already be aware of what orthodontics is all about. And you will attend those clinics and see some orthodontic patients who are requiring treatments such as closure of spaces and any irregularities within their teeth. Pediatric dentistry, we have outreach clinics where you will see some of our pediatric patients, again under the supervision of staff, and carry out any necessary treatment for those younger patients. So it's lots of hard work, but you'll find our students will tell you it's enjoyable being on clinics and very rewarding whenever your treatments are completed and your patients are delighted with all your hard work. Just to recap at this stage, to remind you, it's a 5-year course. It is possible to take a year out to study one of the basic core sciences as an intercalated degree. Some of our students carry out volunteer work in dental charities, and that's especially so maybe between 4th and 5th year, whenever they've got some of their skills up and running. So, who are we looking for? What sort of person? So we want someone who has good scientific ability. You want to show us that you have that manual dexterity. You need to really want to work closely with patients and people. So you will either be dealing with a dental nurse on a one-to-one basis, or be dealing with a patient on a one-to-one basis, and you have to want to help those patients. You need to be conscientious, and there's no doubt about it, hard working. We would require a high standard of professional ethics, so somebody who wants to do the right thing. And it also helps if you have a nice, calm disposition to soothe those nervous patients. So what do our students say about this? And this is one of our students who's already graduated, and what she says about our undergraduate course.
My name is Susie Harkness. I'm from Northern Ireland and I've just finished studying dentistry at Queen's University. It was mostly sort of science-based the first 2 years, so it was a lot of sort of biology, things like that, just sort of expanding on what you did at school and going into things in a bit more detail. There was also a bit of lab work, dental concepts as to sort of caring for people and that sort of thing. From 3rd year, 4th and 5th year, it all got a lot more clinical. So you move to the dental school, which is based at the Royal Victoria Hospital. The way it works in the dental school is it's sort of big rooms with lots of dental chairs in them and little partitions in between, so you're never too far from your friends, and you sort of work away there. There's always staff on clinic, so if you need to ask any questions, there's always member staff there that can come over and give you a hand. You would go out to different clinics across Belfast.
Okay, so that's our School of Dentistry. Any questions, any thoughts you have, you can let us know. But that's our front door for School of Dentistry, and it'll be lovely to see you all there very soon. Thank you.